Hormones are like the body's messengers. They travel through your bloodstream, telling different parts of your body what to do. When it comes to mental health, hormones play a huge role in how you feel emotionally and mentally. Let's break it down. What are hormones? Hormones are chemicals produced by glands in your body. These glands make up what's called the endocrine system. Think of this system as the control center for many of your body's functions. Some key players in the endocrine system include the thyroid gland, adrenal glands, and ovaries. Each of these produces hormones that affect everything from your metabolism to your mood. For women, hormones like estrogen and progesterone are especially important. These hormones aren't just about reproduction, they also influence how you think, feel, and react to stress. For example, when estrogen levels drop, some women may notice they feel more irritable or anxious. This is why understanding hormones is so crucial for mental health. Let's talk about serotonin, often called the happy hormone. Serotonin helps regulate your mood, sleep, and even appetite. Estrogen actually boosts serotonin production, so when estrogen levels are high, you might feel happier and more balanced. But when they dip, like during certain phases of your menstrual cycle or menopause, you might feel more down or stressed. Another hormone worth mentioning is cortisol, the stress hormone. Cortisol is essential for helping your body respond to stress. However, if cortisol levels stay too high for too long, it can lead to anxiety, depression, and even physical health problems. Hormonal imbalances can throw off cortisol regulation, making it harder for women to manage stress effectively. Your brain has special receptors that interact with hormones. For instance, estrogen receptors are found in areas of the brain that control emotions and memory. This means that when estrogen levels change, it can directly impact how you process emotions and remember things. It's no wonder that hormonal shifts can sometimes leave women feeling forgetful or emotionally overwhelmed. Progesterone also plays a role here. Often called the calming hormone, progesterone has a soothing effect on the brain. When progesterone levels are low, some women may experience heightened anxiety or trouble sleeping. This is why hormonal balance is so important for mental well-being. Understanding how hormones affect mental health isn't just academic, it's practical. If you know why you're feeling a certain way, you can take steps to address it. For example, if you notice mood swings around your period, you might try dietary changes or stress-reducing activities to help balance your hormones naturally. Moreover, recognizing the link between hormones and mental health can reduce stigma. Many women feel ashamed or confused when they experience emotional ups and downs related to hormonal changes. Knowing that these feelings are normal and biological can be incredibly empowering. There's a lot of misinformation out there about women's mental health and hormonal changes. Unfortunately, these misconceptions can prevent women from getting the support they need. Let's clear up some common myths. A lot of people think hormonal fluctuations only happen later in life, but that's not true. Hormonal changes start early, in puberty, and continue throughout a woman's life. For example, the menstrual cycle causes regular hormonal shifts every month. Pregnancy and postpartum periods bring their own set of hormonal challenges. Even perimenopause, which can start in your 30s or 40s, involves significant hormonal changes. These fluctuations don't just affect your body, they can also impact your mental health. Ignoring these changes can lead to unnecessary suffering. By acknowledging that hormonal shifts occur at all stages of life, we can better prepare ourselves to handle them. You've probably heard someone dismiss a woman's emotions by saying, "Oh, she's just hormonal." While hormones do play a role in mood, dismissing emotional struggles as unavoidable is harmful. Not every bad day is caused by hormones, and not every hormonal shift leads to mood swings. Sometimes external factors like stress, relationships, or work pressures are to blame. Labeling all emotional responses as hormonal minimizes real mental health issues. Conditions like premenstrual dysphoric disorder or postpartum depression are serious and require proper care. It's important to validate women's experiences instead of brushing them off. Society often tells women to push through tough times without seeking help. This mindset is dangerous because untreated mental health issues can worsen over time. Whether it's therapy, medication, or lifestyle changes, there are many ways to manage hormonal-related mental health challenges. Seeking help isn't a sign of weakness, it's a sign of strength. Women deserve access to resources that allow them to thrive mentally and physically. Breaking free from the stigma of asking for help is a critical step toward better mental health. While hormonal shifts can cause challenges, they aren't always bad. For example, higher estrogen levels during certain phases of the menstrual cycle can boost creativity and confidence. Similarly, some women report feeling more energized and focused during ovulation. By reframing our perspective, we can see hormonal changes as opportunities to learn more about ourselves. Instead of dreading these shifts, we can use them to deepen our self-awareness and develop coping strategies. Misinformation creates barriers to care. When women believe myths about their mental health, they may hesitate to seek treatment or dismiss their symptoms as unimportant. Educating ourselves and others about the realities of hormonal changes can break down these barriers. Knowledge is power. The more we understand about women's mental health, the better equipped we are to advocate for ourselves and others. Let's challenge outdated ideas and create a culture where women feel supported in managing both their physical and mental well-being. Puberty is a time of massive change, not just physically, but emotionally and mentally too. For many young women, this period can feel overwhelming. Let's explore what's happening in the body and mind during puberty and how to navigate these early hormonal shifts. What happens during puberty? Puberty kicks off when the brain signals the body to start producing sex hormones like estrogen and progesterone. These hormones trigger physical changes like breast development, the start of menstruation, and growth spurts. But they also affect the brain, which is still developing during adolescence. This combination can lead to intense emotions and mood swings. Estrogen in particular plays a big role in shaping the adolescent brain. It influences areas responsible for decision-making, impulse control, and emotional regulation. Since these parts of the brain aren't fully mature yet, it's no wonder that teenagers often feel like they're on an emotional roller coaster. During puberty, hormone levels fluctuate wildly. One day, estrogen might be high, making you feel confident and happy. The next day, a drop in estrogen could leave you feeling irritable or sad. Add to that the social pressures of adolescence, like fitting in with peers or dealing with academic stress, and it's easy to see why emotions can feel so intense. Progesterone also comes into play here. While estrogen tends to boost mood, progesterone has a calming effect. However, imbalances between these two hormones can contribute to feelings of anxiety or irritability. This is why some girls may struggle more than others during puberty. It's all about how their bodies respond to hormonal changes. The good news is that there are ways to manage the emotional ups and downs of puberty. One effective strategy is building healthy habits early on. Regular exercise, for example, helps regulate hormones and reduces stress. Activities like yoga or dancing can be especially helpful because they combine movement with mindfulness. Sleep is another critical factor. During puberty, the body needs more rest to keep up with all the changes happening. Unfortunately, many teens don't get enough sleep due to busy schedules or late-night screen use. Encouraging consistent bedtime routines can make a huge difference in mood and overall well-being. Talking openly about emotions is also key. Many young women feel isolated during puberty because they think they're the only ones struggling. Parents, teachers, and mentors can help by creating safe spaces for teens to express themselves without judgment. Diet plays a big part in managing hormonal changes during puberty. Foods rich in omega-3 fatty acids, like salmon and walnuts, support brain health and can improve mood. On the flip side, sugary snacks and processed foods can cause energy crashes and worsen mood swings. Encouraging teens to eat balanced meals with plenty of fruits, vegetables, and whole grains can set them up for success. Hydration is important too. Dehydration can mimic symptoms of anxiety and fatigue, making emotional challenges even harder to handle. While mood swings are normal during puberty, persistent feelings of sadness, anger, or hopelessness shouldn't be ignored. If a young woman is struggling to function at school or in relationships, it might be time to consult a healthcare provider. Conditions like depression or anxiety can emerge during adolescence and require professional support. Early intervention is crucial. By addressing mental health concerns early, we can prevent them from worsening over time. Therapy, counseling, or even group support programs can provide valuable tools for coping with hormonal and emotional changes. The reproductive years bring unique hormonal challenges, from the monthly menstrual cycle to the transformative experiences of pregnancy and postpartum. Understanding these phases can empower women to take charge of their mental health. For most women, the menstrual cycle is a monthly reality, but did you know that each phase of the cycle comes with its own hormonal shifts and emotional effects? The cycle has 4 main phases: menstruation, follicular phase, ovulation, and luteal phase. During the follicular phase, right after your period, estrogen starts to rise. This can boost energy levels and improve mood. Ovulation, which happens mid-cycle, is often associated with heightened confidence and sociability thanks to peak estrogen levels. But then comes the luteal phase, where progesterone takes center stage. While progesterone is calming, its dominance can sometimes lead to premenstrual symptoms like irritability, bloating, or fatigue. For some women, these symptoms escalate into premenstrual syndrome, or PMS, or even premenstrual dysphoric disorder, PMDD, a more severe form of PMS. If you experience mild PMS, lifestyle changes can help. Regular exercise, stress management techniques, and a nutrient-rich diet can ease symptoms. Magnesium supplements, for instance, have been shown to reduce cramps and improve mood. For those with PMDD, professional support may be necessary. Cognitive behavioral therapy, CBT, and medications like antidepressants can be effective. Tracking your cycle using apps can also help identify patterns and prepare for challenging days. Pregnancy brings dramatic hormonal changes as estrogen and progesterone soar to support fetal development. While some women feel an emotional glow, others experience anxiety, mood swings, or even depression. These feelings are valid and should be addressed. Self-care becomes especially important during pregnancy. Gentle exercises like prenatal yoga, adequate sleep, and connecting with loved ones can promote emotional well-being. It's also essential to attend regular checkups so healthcare providers can monitor both physical and mental health. After childbirth, hormone levels plummet rapidly, which can trigger the baby blues or, in more severe cases, postpartum depression. The baby blues typically resolve within a couple of weeks, but postpartum depression requires treatment. New mums need support, not just for their babies, but for themselves too. Talking openly about struggles, leaning on family and friends, and seeking professional help when needed can make all the difference. Support groups for new mothers can also provide a sense of community and understanding. Understanding the hormonal ebbs and flows of the reproductive years allows women to anticipate challenges and plan accordingly. Whether it's tracking your menstrual cycle, preparing for pregnancy, or navigating postpartum recovery, knowledge empowers women to prioritize their mental health every step of the way. Perimenopause is often described as the transition phase before menopause officially begins. It can start in a woman's late 30s or early 40s and last for several years. During this time, hormone levels, especially estrogen, begin to fluctuate unpredictably. These hormonal shifts can bring about a wide range of physical and emotional symptoms, which can be confusing and overwhelming if you're not prepared for them. What exactly is perimenopause? Perimenopause is essentially your body's way of preparing for menopause, which marks the end of your reproductive years. During perimenopause, your ovaries gradually produce less estrogen. This decline isn't steady. It happens in waves, leading to irregular periods and other symptoms. Some women breeze through perimenopause with minimal issues, while others find it to be a challenging time emotionally and physically. The length of perimenopause varies from person to person. For some, it lasts just a few years. For others, it can go on for a decade or more. Understanding that this phase is temporary can help ease some of the frustration and anxiety that often accompany it. One of the most noticeable effects of perimenopause is its impact on mood. Fluctuating estrogen levels can lead to increased irritability, anxiety, and even depression. Many women report feeling more emotionally sensitive during this time, reacting strongly to situations that wouldn't have bothered them before. Sleep disturbances are another common issue. Night sweats and hot flashes can disrupt sleep, leaving you feeling exhausted and irritable during the day. Poor sleep can also exacerbate feelings of stress and anxiety, creating a vicious cycle that's hard to break. Memory lapses or brain fog are also frequently reported during perimenopause. Estrogen plays a role in cognitive function, so when levels drop, some women notice they have trouble concentrating or remembering things. This can be frustrating, especially if you're used to being sharp and focused. While perimenopause can be challenging, there are plenty of ways to manage symptoms and maintain your mental well-being. One of the most effective strategies is regular exercise. Physical activity helps regulate hormones, improves mood, and reduces stress. Even something as simple as a daily walk can make a big difference. Mindfulness practices like meditation and deep breathing can also help calm the mind and reduce anxiety. These techniques teach you how to stay present and manage overwhelming emotions, which can be particularly helpful during perimenopause. Diet plays a crucial role too. Foods rich in phytoestrogens, like soy, flax seeds, and chickpeas, can mimic estrogen in the body and may help balance hormone levels. Avoiding caffeine and alcohol, especially close to bedtime, can also improve sleep quality and reduce hot flashes. If perimenopausal symptoms are significantly affecting your quality of life, it's important to reach out to a healthcare provider. Hormone replacement therapy, or HRT, is one option that can help alleviate severe symptoms, though it's not right for everyone. Non-hormonal treatments, such as antidepressants or cognitive behavioral therapy, also known as CBT, can be effective for managing mood swings and anxiety. The key takeaway is that you don't have to suffer in silence. There are many tools and resources available to help you navigate perimenopause with greater ease and confidence. Menopause marks the official end of menstruation and fertility, typically occurring in a woman's late 40s or early 50s. While menopause itself is a natural part of aging, the long-term hormonal changes that come with it can have lasting effects on mental health. Understanding these changes and learning how to adapt can help women thrive during and after menopause. What happens during menopause? During menopause, estrogen and progesterone levels drop significantly and remain low. This hormonal shift can lead to a variety of physical symptoms, such as hot flashes, vaginal dryness, and weight gain. But it also has a profound impact on mental health. Many women experience mood swings, anxiety, or even depression during this time. The drop in estrogen in particular can affect serotonin levels, which may contribute to feelings of sadness or irritability. Additionally, the loss of estrogen can impact memory and cognitive function, making it harder to focus or recall information. These changes can be unsettling, especially if you're used to feeling mentally sharp. One of the best ways to support your mental health during menopause is through nutrition. A diet rich in whole foods, like fruits, vegetables, lean proteins, and healthy fats, can provide the nutrients your body needs to function optimally. Foods high in omega-3 fatty acids, such as salmon and walnuts, are particularly beneficial for brain health and can help stabilize mood. Calcium and vitamin D are also important during menopause, as they help protect bone health. Low bone density is a common concern for postmenopausal women, and maintaining strong bones can reduce the risk of fractures and other complications. Regular physical activity is essential for managing both the physical and emotional symptoms of menopause. Exercise boosts endorphins, which are natural mood lifters, and helps combat anxiety and depression. Weight-bearing exercises like walking or strength training are especially beneficial because they strengthen bones and muscles. Yoga and Tai Chi are excellent options for women who want to combine physical activity with mindfulness. These practices not only improve flexibility and balance, but also promote relaxation and stress reduction. Maintaining strong social connections is another key factor in long-term mental health. As women age, they may face significant life changes, such as children leaving home or retirement. These transitions can sometimes lead to feelings of loneliness or isolation. Staying connected with friends, family, and community groups can help combat these feelings. Joining clubs, volunteering, or participating in group activities can provide a sense of purpose and belonging. Sharing experiences with other women who are going through menopause can also be incredibly validating and supportive. For some women, the emotional challenges of menopause persist long after their last period. Chronic anxiety or depression may require professional intervention. Therapy, counseling, or medication can be effective treatments, depending on the severity of symptoms. Cognitive behavioral therapy, or CBT, is particularly useful for addressing negative thought patterns and developing healthier coping mechanisms. Antidepressants may also be prescribed if symptoms are severe or persistent. Menopause doesn't have to be viewed as an ending. It can be seen as a new beginning. With the right mindset and tools, women can continue to live fulfilling, vibrant lives well into their later years. By prioritizing mental and physical health, staying socially engaged, and seeking help when needed, women can navigate menopause with grace and resilience. Polycystic ovary syndrome, or PCOS, is one of the most common hormonal disorders among women of reproductive age, affecting up to 10% of women worldwide. While PCOS is often associated with physical symptoms like irregular periods, weight gain, and acne, its impact on mental health is just as significant and often overlooked. Understanding the connection between PCOS and mental health can help women manage both their physical and emotional well-being more effectively. What is PCOS? PCOS occurs when a woman's ovaries produce higher than normal levels of androgens, or male hormones, such as testosterone. This hormonal imbalance disrupts the normal menstrual cycle, leading to issues like irregular ovulation, cysts on the ovaries, and insulin resistance. Insulin resistance, in particular, plays a key role in the development of many PCOS symptoms, including weight gain and difficulty losing weight. But PCOS doesn't just affect your body, it also affects your mind. Women with PCOS are at a higher risk for mood disorders, anxiety, and depression. The reasons for this are complex and involve both hormonal imbalances and the psychological stress of living with a chronic condition. One of the main culprits behind the mental health challenges associated with PCOS is insulin resistance. When your body becomes resistant to insulin, it can lead to elevated blood sugar levels, which in turn can cause inflammation in the brain. Chronic inflammation has been linked to an increased risk of depression and anxiety. Additionally, the hormonal imbalances caused by PCOS, such as high levels of androgens, can directly affect mood regulation. Androgens are known to influence neurotransmitters like serotonin and dopamine, which play a crucial role in how we feel emotionally. When these neurotransmitters are out of balance, it can lead to feelings of irritability, sadness, or even panic. Beyond the biological factors, PCOS can take a toll on mental health through its impact on self-esteem and body image. Many women with PCOS struggle with weight gain, acne, and excessive hair growth, all of which can lead to feelings of shame or embarrassment. These physical changes can make women feel less confident in their appearance, which can contribute to low self-esteem and social withdrawal. For some women, the frustration of trying to manage PCOS symptoms, like infertility or chronic fatigue, can lead to feelings of hopelessness or even burnout. It's not uncommon for women with PCOS to feel like they're fighting an uphill battle, especially if they've struggled to find effective treatments or support from healthcare providers. While there's no one-size-fits-all solution for managing PCOS, a holistic approach that addresses both physical and mental health can be incredibly effective. Here are some strategies that can help balance diet. Eating a diet rich in whole foods, particularly those that are low in refined carbs and sugars, can help manage insulin resistance. Foods like leafy greens, lean proteins, and healthy fats can stabilize blood sugar levels and reduce inflammation. Regular exercise, physical activity is a powerful tool for managing both PCOS symptoms and mental health. Exercise helps regulate insulin, reduces stress, and boosts mood. Even moderate activities like walking or yoga can make a big difference. Mindfulness practices, techniques like meditation, deep breathing, and journaling can help women with PCOS manage stress and anxiety. Mindfulness practices encourage you to stay present and focus on what you can control rather than getting overwhelmed by symptoms. Therapy and counseling. Talking to a therapist can provide valuable support for women struggling with the emotional impact of PCOS. Cognitive behavioral therapy, or CBT, is especially effective for addressing negative thought patterns and building resilience. If you're experiencing persistent feelings of sadness, anxiety, or hopelessness, it's important to seek professional help. Depression and anxiety are common among women with PCOS, but they don't have to be accepted as inevitable. A healthcare provider can help you explore treatment options, including medication, therapy, or lifestyle changes. Remember, you're not alone in this journey. Many women with PCOS find comfort in connecting with others who share similar experiences. Online support groups and forums can be a great way to find community and encouragement. Thyroid disorders, such as hyperthyroidism and hypothyroidism, are another common hormonal issue that can significantly impact mental health. The thyroid gland produces hormones that regulate metabolism, energy levels, and even mood. When the thyroid isn't functioning properly, it can throw your entire system out of balance, leading to both physical and emotional symptoms. Understanding hypothyroidism and hyperthyroidism. Hypothyroidism occurs when the thyroid gland doesn't produce enough thyroid hormone, leading to a slowdown in metabolism. Symptoms include fatigue, weight gain, cold intolerance, and depression. On the other hand, hypothyroidism happens when the thyroid produces too much hormone, causing symptoms like rapid heartbeat, weight loss, anxiety, and irritability. Both conditions can have a profound effect on mental health. Hypothyroidism, in particular, is strongly linked to depression and cognitive issues, while hyperthyroidism is often associated with anxiety and mood swings. The good news is that with proper diagnosis and treatment, many of these symptoms can be managed effectively. The thyroid gland plays a critical role in regulating neurotransmitters like serotonin and dopamine, which are responsible for mood regulation. When thyroid hormone levels are off, it can disrupt the balance of these neurotransmitters, leading to emotional instability. For example, women with hypothyroidism often report feeling sluggish, unmotivated, and emotionally flat. This can make it difficult to enjoy life or engage in activities that once brought happiness. Over time, untreated hypothyroidism can lead to clinical depression, which may require medication or therapy to address. Hypothyroidism, on the other hand, can cause feelings of nervousness, restlessness, and even panic attacks. The overproduction of thyroid hormones can make it hard to relax, leading to chronic anxiety and irritability. Some women with hypothyroidism describe feeling like they're constantly on edge, which can take a toll on relationships and overall quality of life. Because thyroid disorders can mimic other conditions like depression or anxiety, it's crucial to get an accurate diagnosis. Blood tests that measure thyroid hormone levels, TSH, T3, and T4, are typically used to diagnose thyroid issues. If you suspect you have a thyroid disorder, it's important to advocate for yourself and request testing if your symptoms persist. Once diagnosed, treatment options vary depending on whether you have hypothyroidism or hyperthyroidism. For hypothyroidism, synthetic thyroid hormone replacement medications like levothyroxine are commonly prescribed. These medications can help restore normal hormone levels and alleviate symptoms like fatigue and depression. For hyperthyroidism, treatments may include antithyroid medications, radioactive iodine therapy, or even surgery in severe cases. In addition to medical treatment, lifestyle changes like stress management, regular exercise, and a balanced diet can help support thyroid health and improve emotional well-being. In addition to medical treatment, there are several self-care strategies that can help women manage the emotional impact of thyroid disorders. For instance, practicing mindfulness techniques like meditation or yoga can help reduce stress and promote relaxation. Getting enough sleep is also essential, as fatigue can exacerbate both physical and emotional symptoms. Diet plays a key role in thyroid health as well. Foods rich in selenium, zinc, and iodine, like Brazil, nuts, seafood, and dairy products, can support thyroid function. However, it's important to avoid excessive consumption of goitrogenic foods, like soy and cruciferous vegetables, which can interfere with thyroid hormone production if eaten in large amounts. Finally, don't underestimate the power of social support. Connecting with others who understand what you're going through can be incredibly validating. Whether it's through a support group, online community, or simply talking to friends and family. Having a strong support network can make a world of difference. When it comes to managing hormone-related mental health issues, mind-body practices can be incredibly effective. These techniques not only help regulate hormones but also reduce stress, improve mood, and promote overall well-being. Let's explore some of the most powerful mind-body practices that women can incorporate into their daily routines. The power of mindfulness. Mindfulness is all about being present in the moment without judgment. It's a simple concept, but it can have profound effects on both mental and physical health. For women dealing with hormonal fluctuations, mindfulness can help reduce anxiety, improve focus, and even alleviate symptoms of depression. One of the easiest ways to practice mindfulness is through meditation. Even just 5 to 10 minutes of meditation per day can make a big difference. You don't need any special equipment. Just find a quiet space, sit comfortably, and focus on your breath. If your mind starts to wander, and it will, gently bring your attention back to your breathing. Over time, this practice can help you feel more grounded and less reactive to stress. Another mindfulness technique is body scanning. This involves mentally scanning your body from head to toe, paying attention to any areas of tension or discomfort. Body scanning can help you become more aware of how stress affects your body, allowing you to release tension and relax more fully. Yoga is another powerful tool for managing hormone-related mental health issues. It combines physical postures, breathing exercises, and meditation to create a holistic approach to well-being. Yoga can help balance hormones, reduce stress, and improve mood. It's also a great way to stay physically active and maintain flexibility and strength. Certain yoga poses are particularly beneficial for hormonal balance. For example, poses that open the hips and pelvis can help stimulate the reproductive organs and improve circulation. Poses that involve gentle twists can aid in detoxification and support the endocrine system. Incorporating a regular yoga practice into your routine can have lasting benefits for both your physical and mental health.